Hi everybody, it's Dr. Cary Yurkiw here. Thanks for joining me today as I talk about ankle and foot problems. This is something that we've seen a lot more of in the clinic recently. People slipping and falling, twisting their ankle, some sports injuries, and improper footwear are things that we're seeing that are causing foot pain and ankle pain. So today I'm going to go over that with you, and I'm just going to switch over to my slides here so you can follow along with me. So again, my name is Dr. Cary Yurkiw. I'm a chiropractor in Kelowna. I've been practicing for 29 years now. I've seen thousands of patients and hundreds of people with foot and ankle problems. So how to get rid of ankle pain? Well, sprains and strains usually happen from twisting the ankle, usually rolling on the outside of the ankle. So quite often we see these inversion types of sprains. An inversion sprain is somebody who's twisted their ankle but rolled it on the outside, and that would be on this part right here on this diagram. So they've rolled it towards the outside, it's strained the ligaments and the joint on the outside part of the foot, and we're going to look at the anatomy in a minute, but I wanted to go over the three different conditions that we'll talk about today. The second way is direct trauma. So I see people that have direct trauma in sports, like maybe a slash to the ankle, a puck off the ankle, running into somebody, something like a water skiing or skiing accident. So there's a sports injury and there's a direct injury to the ankle joint. And then also what I see is heel spurs and plantar fasciitis. Now that's kind of a fancy word, but it means a strain of the under part of the foot, the arch, the long arch that goes from back to front, and it attaches into the bones in the front of the foot and the heel bone in the back. And if you overuse that arch, the fascia, which is the covering of the muscles, can get strained, and that causes inflammation. And then over time, we can start to see things like a heel spur develop. So usually this is from wearing improper footwear that's maybe too high of a heel, or the foot's getting squished into the shoe, or the shoe has the wrong arch, and it's causing repetitive strain on the arch of the foot. I'm just going to bring over this diagram right here, and this is the ankle joint. So we're going to talk about that. So here in the ankle joint, we have the outside bone in the shin, which is called the fibula, the shin bone, which is called the tibia. And then on the outside part of the foot, we have a number of different ligaments going between the bones just to stabilize the bones, hold them together. Quite often, what happens is when someone rolls their ankle, it's this calcaneofibular joint that gets stretched. Sometimes there's some tearing of it, and there's 3 different degrees of sprains. So sprains refer to more the ligaments. Strains refer to the tendons. The tendons go from the muscle attached into the bone. Tendons tend to be stronger, ligaments weaker. So quite often we see a sprain of these ligaments, and it can even involve this anterior talofibular ligament right there. And that's the one that's going between the talus. This is the bone right here. We'll look at that on this other diagram in a minute. And then the ankle joint here, the main joint. Sometimes we refer to that as the mortise joint, or the main joint in the ankle, where the force is coming down the shin, then translating horizontally, so at a 90-degree angle. And it's a very important joint to maintain the proper balance and function of the foot. So quite often we see a strain or sprain to the ankle joint right here in this mortise joint. If we look at it from the inside of the foot, there's these ligaments right here. There's quite a few of them coming together, and that's the deltoid ligament, very strong ligament. That's on the inside part of the ankle. Rarely do people roll their ankle on the inside, but I have seen it. And then there's the tibia, the shin bone, the outside bone, the fibula, the calcaneus, the heel bone. And here's the plantar fascia right there that we were talking about, going from the heel to the tarsals here in the midfoot. So you see the fascia right there. And if that arch is getting strained, you're going to get pulling away of the fascia from the bone, creating some calcium deposits, repair, and then that can result in a heel spur. Sometimes we see misalignments or sprains of the metatarsals over here, or the phalanges right here. but more so the earlier conditions that I was going over. So I'm just going to get out of this slide right here, and I'm going to go into what we do. So in the clinic, when someone comes in, I do a history, then an examination, diagnostic tests of the foot, which could include x-rays. Then what I tell the patient is the diagnosis, what the problem is. We often have a differential diagnosis or more than one of what it could be. So we always want to have a backup diagnosis or a plan B. And then the treatment. So the treatment involves realignment of the ankle joint. Sometimes I'll use an instrument to adjust the bones because they're smaller. Sometimes I'll use something like traction where I pull on the ankle to realign the ankle bone. The adjustments are there to restore the function of the joint as well. Then I'll give the patient stretches to do at home, some strengthening, work on their posture, their alignment of the foot and their alignment in general. Talk about things like shoe wear, getting the right support, maybe an arch support in the shoe. And then lifestyle. So what can they do lifestyle-wise to keep the ankle in good condition? If you're interested in contacting me or you'd like to come to the clinic, I am accepting new patients in Kelowna. My contact info, there's my email address, our website, www.drcaryyurkiw.com. My phone number, 250-486-0062. Follow me on social media at Dr. Cary Yurkiw. Been doing some Twitter spaces lately. I might do one on this topic tonight, so please join me on Twitter for Twitter spaces as I talk about the ankle joint tonight. And then I've been uploading these videos to YouTube as well as our podcast. Spotify allows video podcasts now, so it's excellent so people can see the slides. And on Apple and Google, you'll get the audio version of this, so that's great because then you'll be able to hear what I'm going over. You're going to get the feed if you subscribe to the channel, which I encourage you to do, and follow along. So hope to see you guys soon. We'll be talking about different conditions we see in the clinic. And then if you're not in the Kelowna area, you can DM me or comment on this post. I'd be happy to refer you to a chiropractor in your area. So thanks so much for joining me today, and we'll talk to you guys soon.